AIDS. It's a word that's carried a lot of fear, stigma, and misinformation over the years. But what is AIDS really? And what should you know about it today? Let's break it down together. AIDS stands for Acquired Immunodeficiency Syndrome. It's the most advanced stage of HIV infection, HIV being the human immunodeficiency virus. When untreated, HIV slowly destroys the immune system, leaving the body unable to fight off infections or certain cancers. That's when we call it AIDS. So, what are the symptoms of AIDS? You might be surprised to know that they're not always obvious at first. AIDS usually develops after years of untreated HIV. Some common signs include chronic fatigue, just always feeling tired, rapid weight loss, frequent fevers or night sweats, and swollen lymph nodes that don't go away. Other symptoms can be persistent diarrhea, white spots or strange lesions in the mouth or on the tongue, skin rashes or bumps, shortness of breath, or a cough that just won't quit. People might get frequent infections like tuberculosis or pneumonia, and even experience memory loss, confusion, or depression. These symptoms happen because the immune system can no longer protect the body from opportunistic infections or certain cancers. But how is AIDS diagnosed? There are two main ways. First, if someone with HIV has a CD4 T-cell count below 200 cells per cubic millimeter, normal levels are 500 to 1600, that's a clear sign. Second, if they develop one or more AIDS-defining illnesses, these include diseases like tuberculosis, a type of pneumonia called PCP, Kaposi's sarcoma, invasive cervical cancer, and some serious fungal or parasitic infections. Doctors use a few different tests: HIV antibody or antigen tests, CD4 cell counts, and viral load tests, which measure how much HIV is in the blood. Now let's talk prevention. The best way to prevent AIDS is to avoid HIV infection in the first place, or to manage HIV effectively if you have it. So how do you prevent HIV transmission? Use condoms during sex and don't share needles or syringes. Get tested regularly and know your partner's HIV status. For people at high risk, there's a medication called pre-exposure prophylaxis or PrEP that can help keep HIV at bay. If you think you might have been exposed to HIV, there's also post-exposure prophylaxis or PEP, which you need to take within 72 hours. Healthcare workers follow strict safety guidelines too, like wearing gloves and disposing of needles safely. And for HIV-positive mothers, proper treatment can prevent passing the virus to their babies during pregnancy, childbirth, or breastfeeding. If you already have HIV, the key to preventing progression to AIDS is early diagnosis and sticking to your medication. This is called antiretroviral therapy, or ART. Now here's some good news. While there's no cure, HIV and AIDS can be managed as chronic conditions. ART is a combination of drugs you take for life. It suppresses the virus, helps the immune system recover, and can even reduce viral levels so low that they're undetectable, meaning you can't transmit HIV to others. That's the U equals U message: undetectable equals untransmittable. Opportunistic infections are treated with antibiotics, antifungals, or antivirals, and cancer may require its own treatment. Supportive care matters too. Good nutrition, mental health support, and a strong community can make all the difference. Let's sum it up. AIDS symptoms include things like fatigue, weight loss, infections, and skin problems. Diagnosis is based on a low CD4 count or certain illnesses. Prevention: practice safe sex, don't share needles, consider PrEP or PEP, and stick to ART if you're diagnosed. Treatment centers on lifelong ART and managing infections or complications. AIDS doesn't have to be a death sentence. With the right information, prevention, and treatment, people with HIV can live long, healthy lives. If you want more resources or a printable guide, just let me know down in the comments. And remember, knowledge is power. Take care of yourself and each other. HIV is a virus. It stands for Human Immunodeficiency Virus. Think of your body as a fortress, protected by a strong army. This army is your immune system. Its job is to fight off germs, infections, and diseases that try to make you sick. The HIV virus is different. It doesn't just attack the fortress. It specifically targets the soldiers in your army. It weakens your body's natural defenses over time. This makes it harder for your body to protect itself. Without a strong defense system, common illnesses that most people fight off easily can become much more serious. That is why understanding this virus is the first step toward managing it. It's important to know how HIV is transmitted. It is not spread through everyday contact. You cannot get it from hugging someone, sharing a meal, or using a public toilet. The virus lives in certain body fluids. These include blood, semen, vaginal fluids, and breast milk. In the early days, an HIV diagnosis was often seen as a death sentence. The world was filled with fear and misunderstanding. But science and medicine have made incredible progress since then. We have come a very long way. Today, the story of HIV is no longer one of despair. It is a story of resilience, innovation, and hope. The key to this incredible transformation is a type of medicine called antiretroviral therapy, or ART. This is not a cure, but it is a powerful and effective treatment. ART works by stopping the HIV virus from making copies of itself inside the body. Imagine the virus is a factory constantly trying to produce more of itself. ART is like a team of inspectors that shuts down the factory's machinery. When the virus can't replicate, its levels in the body drop dramatically. This gives the immune system, our body's army, a chance to recover and rebuild its strength. When a person starts ART and takes it as prescribed, something amazing happens. The amount of HIV in their blood, known as the viral load, can become so low that standard tests can no longer detect it. This is called having an undetectable viral load. Reaching this milestone is the primary goal of HIV treatment. It is a clear sign that the medicine is working effectively. It allows a person's immune system to function properly again, protecting them from opportunistic infections. One of the most powerful messages in the world of HIV today is U equals U. This simple equation stands for undetectable equals untransmittable. It is a message backed by overwhelming scientific evidence from multiple large-scale studies. What it means is truly revolutionary. A person living with HIV who is on effective antiretroviral therapy and has achieved and maintained an undetectable viral load cannot sexually transmit the virus to their partners. This is not a theory or a guess, it is a scientific fact. The medical advancements we've discussed are truly remarkable. Antiretroviral therapy and the reality of U equals U offer a clear path to a secure future. However, this future is only possible if everyone has access to these life-saving tools. Unfortunately, that is not yet the case. Significant disparities exist in access to HIV testing, treatment, and care. A secure future for people with HIV must be a future for all people with HIV. We cannot leave anyone behind. Universal access means that every single person, regardless of who they are, where they live, or how much money they have, can get tested for HIV. Achieving universal access requires a concerted global effort. It requires investment from governments, support from international organizations, and the work of community-based groups on the ground. Building a secure future for people living with HIV involves more than just medicine. The virus itself can be controlled with pills, but there is another, more insidious challenge: stigma. HIV-related stigma refers to the negative attitudes, beliefs, and prejudices against people living with HIV. It's born from fear and misinformation. This stigma can lead to discrimination, which is the act of treating someone unfairly because of their HIV status. To build a truly secure future, we must actively fight stigma and discrimination. This fight begins with education and conversation. We need to replace myths with facts. We need to talk openly about HIV to normalize it and strip away its power to inspire fear. The U equals U message is a critical tool in this fight, as it directly counters the fear of transmission. Strong support systems, made up of family, friends, and peers, can make all the difference. Having people to talk to, lean on, and share experiences with provides the strength and resilience needed to navigate the challenges of living with a chronic health condition. While we work to support everyone currently living with HIV, we must also be relentless in our efforts to prevent new infections. Education is the cornerstone of this prevention effort. For people who are at high risk of acquiring HIV, there is a powerful tool called PrEP, or pre-exposure prophylaxis. Another critical component of prevention is testing. The connection between physical and mental health is undeniable, and this is especially true for people living with HIV. The emotional weight of a diagnosis, the stress of managing a lifelong condition, and the experience of stigma and discrimination can take a significant toll on a person's mental well-being. A secure future must include robust support for mental health. We have journeyed through the modern landscape of HIV, from understanding the virus to the miracles of treatment and the importance of support. The message is clear: a secure, healthy, and long future for people living with HIV is not just a distant dream. It is an achievable reality. We have the scientific tools, the medical knowledge, and the prevention strategies to make it happen. But this future will not build itself. It requires our collective action, our shared commitment, and our unwavering hope. It requires governments to invest in healthcare and protective laws. It requires scientists and researchers to continue innovating for even better treatments and one day, a cure. For those living with HIV, know that you are not defined by your diagnosis. Your life is yours to live to the fullest. You can dream big, love deeply, and build the future you want. The medical community stands with you, offering treatments that allow you to live long and well. Let us move forward together with a unified purpose. Let us ensure that every person has access to life-saving medicine. Let us champion the U equals U message until it is known in every corner of the globe. Let us fight stigma until it no longer has any power. By joining forces, we can not only build a secure future for everyone living with and affected by HIV, but we can also move closer to the day we see an end to this epidemic. This is our challenge, and this is our promise.